Welcome, and thank you for joining us today for the Notice of Special Interest, Research to Improve Interprofessional Teamwork and Coordination During Cancer Diagnosis and Treatment webinar. My name is Jennifer, and I will be your WebEx host. Before I turn today's presentation over to Dr. Sally Weaver, I'd like to provide a few housekeeping items. All attendees have been muted upon entry and will remain muted for the duration of the webinar. Please submit your questions throughout the presentation in the Q&A or chat panel and select all panelists from the drop-down. We will ask them on your behalf during the Q&A portion of the webinar. Questions about specific aims or your application will not be addressed during the webinar. This webinar is being recorded, and now I'd like to pass it over to Dr. Weaver.
Hello, everybody, and thank you so much for taking time to join the call today, and thanks to all of you who took the time to submit your questions in advance. As Jennifer mentioned, my name is Sally, and I'm excited to be presenting today with my colleague, Veronica Gillette. Veronica is one of my fellow program directors and a collaborator on the Healthcare Teams Initiative in the Healthcare Delivery Research Program, and she's kindly going to be assisting with the Q&A portion of today's webinar. I'd also like to say a big thank you to Jennifer Schaefer and Crystal Reed for their assistance in setting up today's webinar. So with that, I'll just start with a brief roadmap for the rest of this afternoon's webinar. I'll start with just a little bit of background about the NCI Healthcare Delivery Research Program, which put this Notice of Special Interest, or NOSI, forward. Then I'll walk through a summary of the NOSI details, including the goal and scope, some application details, and resources. And then last but not least, we've reserved time at the end for your general questions. Just to reiterate what Jennifer mentioned earlier, on the call today, we can answer questions about your project-specific aims, but both Veronica and myself are more than happy to speak with you one-on-one if you have specific questions related to your project. We've tried to be sure to provide our email addresses throughout today's webinar, and I definitely would encourage you to reach out to us by email if you have any questions specific to your project. Also want to just reiterate what Jennifer mentioned earlier, that the webinar slides, the list of frequently asked questions, and a recording of today's webinar will be posted on the web for you to access in just a couple of weeks. So with that, I'll start by sharing just a little bit of background about the NCI Healthcare Delivery Research Program, which has really been the home for the Teamwork and Care Coordination Science Initiative since 2015. So the Healthcare Delivery Research Program, or HDRP, which is in light blue on this slide, is one of 4 extramural research programs and 2 offices that make up NCI's Division of Cancer Control and Population Sciences, that dark blue box on this slide. Overall, the division has the lead responsibility at NCI for supporting research in cancer surveillance, epidemiology, cancer-related health services, behavioral science, and cancer survivorship. And the division also houses the Office of Cancer Survivorship and Implementation Science team. So as one of these 4 extramural research programs that make up the division, HDRP is responsible for planning, stimulating, and managing portfolios of extramural research that's done by external investigators who have been awarded grants, cooperative agreements, and contracts. Overall, our mission is really to advance innovative research that reduces the burden of cancer by improving the delivery of cancer-related care. And as a program, we're really organized into 3 branches that oversee and facilitate our healthcare delivery research portfolio. And this includes the Outcomes Research Branch, which is the smallest circle that you see on this slide. And the Outcomes Research Branch coordinates and sponsors research focused on measuring, monitoring, evaluating, and improving patient experience and health outcomes across the cancer continuum. The Health Systems and Interventions Research Branch, where Veronica and I work, really supports a portfolio of both observational and intervention research that examines how multi-level contextual factors related to patients, clinicians, practice settings, delivery systems, insurance, and policy influence care processes and outcomes. And of particular interest is work developing and evaluating interventions that target these factors and improve cancer care delivery. And last but not least is the Healthcare Assessment Research Branch, and they really focus on research that looks at how demographic, social, economic, and health system factors influence access and provision of cancer care at the population level. So many of our studies that are focused on patterns of care, financial burden, and outcomes of health services and health disparities at the population level are housed within the Healthcare Assessment Research Branch. So as I mentioned, both Veronica and I are from the Health Systems and Interventions Research Branch, and we've been co-leading the portfolio of activities related to teaming and care coordination. So with that, let's move on and talk a little bit about the background underlying this specific Notice of Special Interest, or NOSI. So of course, as most folks on the line are likely already aware, care coordination challenges are growing with the expansion of treatment options, multimodality treatment regimes, the increasing of an aging population with comorbidities. All of these are really intensifying demands for interprofessional team-based cancer care. We also know that suboptimal care coordination is a common challenge. There is a significant proportion of cancer patients that report experiencing issues coordinating their treatment. And we also know that suboptimal coordination is costly. It affects care costs, workload, adherence, outcomes, and medical errors. And the challenges of teaming well and coordinating care effectively are growing for both patients and clinical team members as the delivery system becomes more complex. There is definitely an increasing range of disciplines involved in care during diagnosis and treatment, and care is increasingly delivered across multiple settings, and people are often seen across multiple clinics, perhaps multiple hospitals, and certainly across multiple providers. So just one example, the National Academies found that folks with lung, GI, breast, and reproductive cancers might see anywhere from 14 to 17 different clinicians during the diagnosis and active treatment phases. And of course, coordination challenges may be amplified for underserved populations. What we're really lacking, though, is evidence about which care team characteristics and teamwork processes actually produce better care quality outcomes and utilization. So in order to address these gaps, NCI developed this Notice of Special Interest, or the NOSI, to encourage and stimulate research on these issues. So with that, let's talk a little bit about some of the details of the NOSI. So I'll start with just a couple of the basics, because I am assuming that many folks on the line are unfamiliar with NOSIs. For NCI, NOSIs represent somewhat of a significant change in how we're communicating some of our research priorities to the research community. Basically, a NOSI is just a standard formal notice that's published in the NIH guide that describes our interest in a specific scientific area and points to funding opportunity announcements through which investigators can apply for support. So usually these notices will encourage applicants to apply through the NIH or our division parent announcements. They are reviewed by standing study sections that are convened by the Center for Scientific Research, and there are no set-aside dollars like an RFA. So prior to 2019, other NIH institutes and centers like NHLBI, NIDA, and others had used such notices, but NCI really didn't. We tended to only use program announcements, or PAs, to do basically the same thing. But going forward, NOSIs like the one we're discussing today are basically planned to replace non-parent program announcements. So here on slide 12, we'll talk a little bit more about the specific goals of this NOSI. So the goal of this NOSI is really to highlight our interest in receiving investigator-initiated grant applications focused on understanding and improving interprofessional teamwork and coordination during diagnosis and treatment. So the focus is really on research that identifies effective strategies for improving performance of interprofessional cancer care teams during diagnosis and treatment, and addressing care coordination challenges either within and or between care settings, so between tertiary and community care settings, or perhaps between hospitals and outpatient clinics. And I just really want to underscore here that the focus is on the interdisciplinary kind of team of teams that is often involved in comprehensive care during diagnosis and treatment. So we're especially interested in applications that look at the interdependencies and coordination either within teams or between teams or care settings. So you could think of studies that are looking at the interdependencies and coordination between the oncology specialist team, perhaps, and the symptom management or palliative care team, or say between the oncology care team and the primary care team that might be providing continued support for comorbid conditions during treatment. Applications can cover a wide range of activities or topics that are related to interprofessional teamwork and coordination during diagnosis and treatment. of course, including but not limited to studies, for example, that identify modifiable features of care team structure that are associated with differences in cancer care quality and patient outcomes. So these, you could think of these as studies looking at issues like care team composition or how the team or team of teams is organized. We're also interested in studies that identify modifiable features of care team processes that are associated with differences in care quality and patient outcomes. And by care team processes, what we're really referring to are teamwork processes like group decision-making, communication, coordination, collaboration, and leadership. Additionally, we encourage applications that are focused on identifying characteristics at the patient, caregiver, care team, delivery organization, health system, or community levels that influence the functioning and effectiveness of interprofessional cancer care teams. We also encourage studies that aim to develop and test interventions to improve quality and patient outcomes by modifying the structure or functioning of interprofessional care teams. And we're also, of course, interested in studies that are developing and testing interventions that are designed to improve quality and outcomes by engaging patients and caregivers as active members of their cancer care team. So to submit an application in response to this notice, this is where things get a little bit different than a traditional funding announcement. In order to submit an application in response to this notice, you must apply through one of the 4 funding announcements listed in the notice. So these include 2 traditional R01 parent funding announcements, one for applications proposing clinical trials and one for applications that are not proposing clinical trials. You can also apply through the modular R01 funding announcement or the NCI program project announcement or PA1 announcement. We'll talk about each of these in greater detail momentarily, but I do want to take a moment to mention right now one question that we've received quite a bit so far, and that's, what if one of the funding announcements listed in the notice expires? I just want to allay your fears immediately and say not to worry. Applications for this notice can be submitted to any reissuance of these 4 announcements as well until the notice itself expires on January 8th, 2022. I also do just want to reiterate that you can only respond to this notice through one of these 4 funding announcements or their reissuance. So you can't just pick any funding opportunity announcement and say it's in response to the NOSI. You have to apply through one of these 4. So on the next couple of slides, I'll talk about each one in a little bit more detail. So the first 2 funding announcements through which you can apply to the NOSI are traditional investigator-initiated R01 parent funding announcements. The R01 mechanism, of course, is designed to support a discrete, specified research project, and it's by far the most commonly used grant mechanism across the NIH. Now, technically, there is not a specific dollar limit for these parent R01s, but we do strongly encourage applicants to stay below $500,000 in direct costs for all years of their application. If you do develop an application where the budget is $500,000 or more in direct costs in any year, you do have to first receive permission from NCI before you actually submit your application. I will say the permission process can be somewhat lengthy, so I definitely encourage you to reach out to Veronica and I as soon as possible if you're considering an application with a large budget. And just for example, we must receive your request for a large budget a minimum of 8 weeks before your targeted receipt date. So, of course, the typical project period for these R01 applications is generally 3 to 5 years, and mostly standard due dates apply. So if you're proposing an R01 research project that includes a clinical trial in response to the NOSI, please be sure to apply through PAR 18559, the Cancer Prevention and Control Clinical Trials Funding Announcement. And if you're proposing an R01 research project without a clinical trial, say an observational study, please be sure to apply through PA 19056, the NIH Parent R01 Research Project, FOA. Now, if you're considering a smaller project, you can also apply to this notice through the DCCPS Modular Research Project R01 funding announcement. So the modular R01 is really designed to support a discrete, specified research project, but the scope, scale, and budget is somewhat smaller than the R01 announcements that we just talked about on the previous slide. So for these applications, budgets may not exceed $250,000 in direct costs, and project periods can be anywhere from 2 to 5 years. So I will say often you see these applications coming in at less than 5 years, since they tend to be somewhat smaller projects. Now, one thing to keep in mind if you're thinking about the modular R01 is that this announcement has only 2 due dates per year, usually in March and November. So if you're thinking about a smaller project or a shorter term project that would fit well with these parameters, you could certainly apply using PAR 18869, the modular R01s in cancer control and population sciences announcement. So last but certainly not least, you can also respond to this notice using the NCI program project or PO1 funding announcement. Now, PO1s are designed to really support an integrated multi-project research initiative that involves a number of independent investigators who share knowledge and common resources. This particular announcement requires an application that includes 3 well-developed research projects. So basically 3 kind of R01 type studies plus an administrative core. Each project itself should contribute to or be directly related to the common theme of the total research effort, and really should overall form a system of research activities and projects that's directed toward a well-defined research program goal. Now, I want to reiterate here, there are some very, very important additional requirements if you're thinking about this type of application. Most importantly, before you submit a PO1 application, you must, for example, have a pre-submission meeting with staff from our research program at NCI, and this pre-submission meeting must occur at least 6 to 9 months before you intend to submit. So, that being said, I strongly encourage you to read the PO1 announcement, PAR 18290, very closely before you consider this type of application, and to reach out to Veronica and I incredibly early if you are considering this type of application. We're more than happy to walk you through the process and help you get set up and be prepared to submit. So in terms of a few just other considerations to think about, applications responsive to the NOSI should clearly advance actionable knowledge about how to design and carry out effective, efficient, interprofessional team-based care that improves quality and patient outcomes. And though it's not required, we do strongly encourage research focused on the needs of racial ethnic minorities, medically underserved or low-income populations, or those receiving care in community settings, so like community-based cancer centers or clinics, for example. There are a few application requirements if you're going to submit an application in response to the NOSI. Of course, you must follow all of the instructions in the funding announcement through which you apply and in the SF 424 application guide. But most critically, you must include the notice number, so NIOT-CA 19059, that must be included in box 4 on the application form, the agency routing identifier field. Applications without this information in box 4B cannot be considered for this initiative. So really be sure to check with your Office of Research, make sure they get this notice number in box 4B. And of course, just be sure to carefully read the entire funding opportunity announcement for which you're applying. If your application meets the NIH definition for a clinical trial, of course, it is important that you're aware of some of the newer NIH requirements for clinical trials research that were implemented back in January of 2018. This is probably familiar to many folks on the line, but just to reiterate, the NIH application form now consolidates all human subjects and clinical trial related information into one section, and also expands some of the information required for clinical trials applications. All investigators and staff working on clinical trials must receive training in good clinical practice. All sites participating in multi-site studies that involve a clinical trial must use a single IRB. And last but not least, all NIH-funded clinical trials are expected to register and to submit their results to clinicaltrials.gov. You can certainly find lots of additional information, related tools, and guides to help you navigate these requirements at the website that's posted at the bottom of this slide. Now, in terms of review, applications for this NOSI will be reviewed by a standing study section that's convened by the NIH Center for Scientific Review. All applications will be reviewed based on the review criteria that's listed in the funding announcement to which you apply. So all applications will receive an overall impact score, and for most of the funding announcements that you can apply through, standard scored review criteria will be applied. So just be sure to read sections 4 and section 5 of the funding announcements you apply to very carefully. Those go through any additional review criteria that's specific to any of the FOAs. So in general, reviewers will be scoring each area on the left of this slide individually, so significance, investigators, innovation, approach, and environment, and we'll consider all of these in their overall impact score. Additional review criteria, you can see that there on the right-hand side, top right-hand side of the slide. Those are not scored individually, but they can be considered in the overall impact score. So this includes things like the study timeline, which actually is required for applications proposing clinical trials, protection for human subjects, as well as plans to address inclusion or exclusion based on your application of individuals on the basis of sex, gender, race, and ethnicity, as well as inclusion or exclusion of individuals of all ages, so including children and older adults. Basically, for this additional review criteria, reviewers will be looking to see if these aspects of the application are well justified in terms of the scientific goals and research strategy proposed. And last but not least, under additional review considerations, reviewers will be asked to comment on whether resource sharing plans or the rationale for not sharing different types of study resources are reasonable. And this is just simply an additional review consideration and is not considered in the overall impact score. So overall, again, just be sure to read that funding announcement very carefully for any additional review criteria, and also to double check what resource sharing plans are required. For example, you may be required to include a data sharing plan. Here on slide 23, we'll just go over a few important dates related to this NOSI. For the earliest submission date, you'll need to check the table in the notice itself. It varies based on the funding announcement you choose to apply through, but most of those earliest submission dates have passed, so you should be good to go. In terms of application due dates, definitely see Part 1 key dates of the funding announcement you select. Some of these announcements, as I mentioned, use standard NIH due dates, but there are a few that do not. And overall, the notice expires January 8th, 2022. So overall, just be sure to start the process early, read the notice, read your funding announcements very carefully, and then when you have a one-page summary or a draft of your specific aims, definitely feel free to discuss with the program contacts, Veronica and I. So as I mentioned, today's webinar will be posted on our website, and I strongly encourage you to reach out to Veronica and I anytime via email. You know, we're more than happy to take a look at a short summary or one-page aims. And I will say, you know, don't worry, it doesn't have to be in final form. It doesn't have to be perfect. We're happy to speak with you at any time or at any phase of your project's development. Here on slide 25, these are just some additional resources that might be useful. The National Cancer Institute and the American Society for Clinical Oncology collaboratively hosted a Teams in Cancer Care Delivery workshop back in, I think it was February of 2016. And from that came a special series of 19 papers and 4 invited commentaries that were published in the November 2016 issue of the Journal of Oncology Practice. And those papers kind of cover a range of interprofessional teamwork and care coordination issues. And so they are all, I think, open access and freely available, so you can check those out if you're interested. We also have a very nice healthcare teams and teamwork process website that's been developed by our communications team, where you can find more information about this Journal of Oncology Practice Special Issue. You can find other relevant funding opportunities in this area of science. You can also register and find out more about our quarterly healthcare teams webinar series, which if you haven't attended one of those, I would definitely encourage you to do so. We have great speakers every quarter talking about some of their research and work focused on teaming and care coordination issues. And there's also some other publications that are relevant to this area of science that might be of interest on that site. So with that, I want to thank you all again so much for taking time to join the webinar today, and we'll start to open things up for questions. Before I turn things over to Veronica, though, I do just want to remind you and go over a few ground rules for questions. We would please ask you to type your question into the Q&A section on the WebEx website. And again, I apologize, but just remember that we cannot answer questions about your specific proposal or idea today, but you can certainly send those to Veronica and I by email. And I also just want to remind folks that, of course, this is a public webinar, so just be mindful of sharing any unpublished data or other information that you would not want to discuss publicly. So with that, I'll turn things over to Veronica Gillette, who will be facilitating the Q&A. Veronica?
Okay, great. Thank you, Sally, for that great presentation. Thank you to our participants also for submitting questions. We do have some that have come in, and we'll start with the first one, Sally, which is, what is the due date for applications submitted in response to this NOSI?
So I'm glad someone asked that. So this is an instance where you'll want to check the key dates listed in the funding opportunity announcement that you choose to submit to. You know, as I mentioned in the presentation, each of those 4 funding announcements, some of them use the standard NIH due dates, but others do not. So just be sure to check the due date in the funding opportunity announcement that you choose to apply to very carefully.
Okay. Another question is, would a study looking at coordination of care for patients with metastatic cancer be responsive to this NOSI?
That's a good question. So I would say, you know, yes, if the study is focused on coordination of care for patients with metastatic cancer, that could certainly be responsive. You know, studies focused on patients pursuing treatment with curative intent would be responsive, but studies of patients pursuing palliative or hospice care only actually would not be responsive, because the NOSI is really focused on diagnosis and active treatment. Of course, we have other, if you are interested in palliative care and hospice care, we have a broad range of other funding mechanisms that would probably be a better fit for that, and Veronica or I would be happy to help you find one of those announcements if this NOSI is not a good fit.
Great. Another question. I would like to use the NCI Community Oncology Research Program networks to conduct my study. Is there anything special that I need to do, or if I want to use that particular network?
I'm glad somebody asked this. Yes, there definitely are a couple of additional steps that need to occur if you're proposing to use the NCORE network to conduct your study, and this process does take some additional time. So if you're thinking about possibly using NCORE, you must speak with the NCI NCORE staff before submitting an application and proposing a study using NCORE. So if you're thinking about that, if it's even in the realm of possibility, please send an email to me and Veronica as soon as possible to let us know you're planning on that. And then we will work with NCI NCORE staff to basically set up a call and kind of outline the process for bringing that application forward.
Great. Another question. Are there specific cancer sites, cancer types, and diseases that NCI is interested in seeing in applications responding to this NOSI?
No, but, you know, so we're not interested in any particular cancer sites or types, but, you know, I think in general, you increase kind of the probability of a favorable review if you mindfully choose a site, type, or disease that represents a significant public health problem. If you really kind of clearly justify your choice, and if your team clearly has the expertise for both accessing and recruiting that population and designing strategies that are responsive in that population. So those are, I think, some key things to think about.
Now, are there particular research designs that will or will not be funded by this announcement?
Good question. So no, we don't prioritize any particular design, but certainly mixed methods design studies and multi-level studies are certainly encouraged, particularly multi-level interventions if you're thinking about an intervention study.
Will NCI accept applications from multiple principal investigators?
Yes. So what we call multiple PI applications are allowed for most of these funding opportunity announcements. But, you know, one thing I always tell investigators before you think about a multiple PI application is you just want to carefully review the multiple PI policy. We have a multiple principal investigators website. For example, there are some implications of that. For example, if both PIs are not an early stage investigator, then that application cannot be considered as an early stage investigator application. So just something to keep in mind there.
If my application was not funded, may I revise and resubmit it?
In general, yes. Resubmission applications are allowed, but just be sure, check the funding opportunity announcement that you're actually applying to. For example, you may need to reapply or resubmit, to the reissued announcement if, say, the original announcement you applied to is expired. So there's some things like that that you'll just want to be aware of and keep in mind.
Right. Does early stage investigator status apply to applications submitted in response to this NOSI?
Another good one. Yeah, so early stage investigator status does apply. So again, one thing to keep in mind for grant applications, if you're thinking about a multi-PI application, all PIs must meet that definition of early stage investigator for the application to be counted as such. You know, in general, as you've probably heard through other outlets and through our website, NCI is certainly committed to supporting early stage investigators, and we're really hoping to be able to continue placing special emphasis on supporting ESI designated applications to this NOSI in particular.
The RFA mentions a focus on team process. Are other types of approaches for understanding and improving teamwork welcomed?
So that's a good question. I think one important thing to clarify is that we're really interested in research that is focused on teamwork processes. But again, you can use whatever approach is relevant to study those processes. So we're interested in teamwork processes like decision-making, coordination behaviors, leadership, those types of things. How you actually study that is really based on your team's expertise and on your research questions that you're specifically proposing to investigate.
Are you interested in research that looks at the integration of health and social service providers, such as social workers, financial navigators, et cetera, or is it strictly medical?
Oh, I'm so glad someone answered this question. No, when we are talking about the cancer care delivery team, we are not just talking about specialty oncology providers. We are talking about the comprehensive team of both providers, allied health, social services, who are involved in providing comprehensive whole person care during the cancer diagnosis and treatment process. So absolutely an application that looks at how those social services providers might be interacting with both the oncology specialist providers, other providers, and the patient and family, kind of that team of teams, would certainly be of interest.
In reading through the notice, when talking about team-based care, is there interest in interventions that involve engaging with primary care, or is the emphasis only on multidisciplinary oncology team care?
Good. You know, another great question. So absolutely, and I think I mentioned that in one of the examples that we talked about at the start. Certainly interested in studies that look at how the primary care team may be interacting with the specialty team over time as part of the diagnosis and treatment process. Say, for example, helping to manage comorbidities or other issues along the way.
Are staff and clinician outcomes a potential area of interest, understanding that improved care is the primary motivation for this or not?
That's a very relevant question. So we certainly are interested in multi-level studies that look at outcomes. You know, care quality and patient outcomes are one of the primary outcomes of interest, but certainly we realize that staff outcomes are critical if we're going to be talking about improving the efficiency of being able to deliver this care in a sustainable way. And so a multi-level study that looked at both, say, care quality outcomes or patient outcomes and provider or clinic outcomes would certainly be of interest.
As sickle cell disease is often treated in cancer treatment facilities and is representative of a minority and disadvantaged population disease, would team coordination related to sickle cell treatment be considered eligible for this funding opportunity?
So that's a great question. So our focus is primarily on cancer-related outcomes, but certainly if sickle cell outcomes were a secondary outcome, I don't think that would be unresponsive to this NOSI.
Well, that's all the questions that we've received, and I'll turn it back over to you.
So I just want to thank everybody who submitted their questions and their participation, and Dr. Weaver for such a great presentation. If you do have any questions that weren't addressed during this webinar, or you want to have a follow-up based on something specific to your application based on the Q&A or based on this presentation, please feel free to reach out to Sally or Veronica. Their emails are up on the screen. You can also visit the HDRP website for additional resources and a recording of this webinar, the slides, and frequently asked questions in the next week or so. Thank you again for your participation.